This is Health Call Live. We're glad you're listening, but don't be afraid to call and ask your question on the air. It's free, non-invasive, and best of all, you don't have to wear an exam gown. Now, back to health and wellness correspondent Lee Kelso.
We're going to catch you up here on what's going on in the fight against COVID-19 in the state of Indiana. We are not looking great, sad to say. Hospitalizations, that's really what I'm paying attention to these days. Case counts, not so important to me. I think the thing that we need to watch is how many people are winding up being hospitalized, and that number is on the increase. We are back to where we were in January right now. We've got let me just give you the official number from the state's dashboard. As of yesterday noon, 2,443 Hoosiers were hospitalized for COVID. They're admitting about 280 people per day in hospitals around the state of Indiana. So, yeah, we've still got a challenge out there. Though, I'm seeing really an interesting shift going on by public health leaders over in Europe, and they are just way ahead of us on all of this. So I think it's worth just taking a minute and examining this. An English leader in vaccine development, he's one of the guys who developed the AstraZeneca vaccine. He told Parliament over there that COVID-19 cannot be stopped. He says we have to start thinking and planning for this virus to shift from being pandemic to endemic. Now, what that means is it's not going away. It's going to be here, ongoing, forever, kind of just like the flu. We're going to have to learn to live with it. Sir Andrew Pollard, as I said, he's one of the AstraZeneca vaccine guys, and he just stepped up and told everybody over there, herd immunity is not a possibility. He says we're in a situation where the current variant Delta and herd immunity just cannot happen because it still infects people who have been vaccinated. And that doesn't mean that anybody who is still unvaccinated at some point is going to be okay. He says sooner or later, if you are unvaccinated, you are going to meet this virus. May not be next month. Here's his quote. Might not be this month or next month. It might be next year. But at some point, they will meet with the virus, and we do not have anything that can stop that transmission. So that's a big shift from what people are saying around here, right? With the Delta variant, we know it can infect people who have been vaccinated, and you have these breakthrough infections. So there's just no way to build a wall around this virus and lock it down. 75% of the English population is vaccinated. We're now at about 60%. And over there, Pollard says they have to be looking ahead. And he is suggesting that you quit monitoring the number of cases so closely and focus on hospitalizations, as do I. Among the vaxxed cases, they are unpleasant. You can be pretty sick, but typically, if you are vaccinated and you are infected, you're not going to wind up in the hospital. That's what we're seeing around the world. So, changing the way they're thinking about this thing over there in Europe. Germany, on the other hand, is real interesting. They now are stepping up restrictions and publishing a digital COVID passport. It goes on your phone, and you have to have it as proof of vaccination to get into restaurants, concerts, and public gatherings. Germany is way behind on vaccination, and so they are in a different phase of the disease than is England. So very interesting to watch what's happening over in Europe, because they got hit before we did. They got hit worse than we did initially, and then we kind of overtook all of that. So what's ahead here in the United States for us? Dr. Avinash Virk is an infectious disease specialist with the Mayo Clinic, and I was invited to attend a briefing with her this week to take a look forward into fall and winter. So she and others around the country are expecting that what we're seeing now in emergency departments is likely to continue and intensify. Here locally, Dr. Scott Myers, who is an assistant professor at IU School of Medicine in Fort Wayne and a pediatric oncologist, he told me the ERs are now seeing COVID and respiratory viruses called RSV. And Dr. Virk says that's very likely to continue, and then we get to add in the fun of having the flu.
So we will see an increase in influenza, definitely higher than last year. And whether it's going to be any higher than our usual influenza outbreak, I don't know. We don't know that. We'll just have to monitor and see what happens. We already know that there is another virus that has had an increase called the RSV virus in the community, which has also kind of surfaced as we have lifted the masking requirements. And so it's really, I think this winter is going to be important for people to be more cautious, because we have Delta variant floating around. We have RSV potentially still there, and we will have influenza. So people need to be really aware of the fact that this winter is going to need to have extra precautions as we go forward.
So lots of fun coming at us here with multiple viruses on the move. And here's a challenge. So you've got the flu, you've got COVID, and you've got RSV circulating through the winter. How do you know what you've got? What symptoms should you be looking for?
All three of them have very similar symptoms. That's why they say the flu-like symptoms, so it's like your headaches, fever, body aches and sore throat. Those are all fairly common amongst the three of them. Obviously, with Delta or with COVID-19, you have loss of taste and loss of smell, which might help you differentiate Delta, but that doesn't mean that everyone is going to have loss of smell and taste. So if somebody has what we call flu-like symptoms, fever, headache, body aches, etc., people need to be aware that they need to mask up, they need to stay at home, they need to not go to work, they need to avoid meeting other people so the transmission is less. But when we see those individuals, we test them automatically for influenza, COVID-19 and RSV. RSV we only do in a subset of population, the immune-compromised individuals. But if somebody comes into the clinic and has those flu-like symptoms, when we do the influenza swab, we will automatically be testing them for COVID-19 as well.
So Dr. Virk says there is a lot of confusion out there around a third dose of the vaccine. She thinks it should be recommended to those who are immune-compromised, but not everybody else. She says she thinks politics got ahead of science about this third dose of the vaccine. She thinks we ought to have more testing and data before it is recommended that everybody jump out there and get a third dose. Now, what about young kids? Are they going to get a vaccine soon? She says it's very likely. Children under age 12 right now are not eligible to get a vaccine, and so they remain a big population where the virus can spread. You bring it home from school, you share it with the family, and because you may have the virus but not have any symptoms, what happens? Well, you keep going to work, you spread it around the office, and the cycle just continues. So there are a number of people in healthcare who think that vaccinating young children is very important to try and stop the spread of this thing, and that's why she is eager to see results from clinical trials that will be wrapping up very soon.
The studies are ongoing and Pfizer is probably the more the furthest along in terms of clinical trials for children. And so the data for the clinical trials for children between 5 and 11 is expected end of September, that they will present to FDA, and FDA will then, weigh in and this basically decide whether they're going to allow the vaccine to be given to children between 5 and 11. Clinical trials for children less than that with Pfizer are also underway right now. By the end of this year, we should have a large proportion of children between, 5 months to 12 years of age getting offered vaccinations.
Boom. Did you hear that? Children as young as 5 months may be eligible for the vaccine by the end of the year. I have my doubts about how many moms are going to vaccinate kids who are still in diapers. I mean, can you imagine the social media storm that's going to happen when that is proposed? It'll be interesting to watch, won't it? So here's the last little bit of COVID news I'm going to share with you. This was a big study, again, involving Stanford. They took a look in Bangladesh, and they put out into several different communities a free supply of masks, and then monitored how people wear them, how do they use them, what messages are meaningful, and what impact does it have. They claim a 9% reduction in spread of the disease with those areas that used masks and were encouraged to use masks, as opposed to those where they just kind of distributed them and said, do your own thing. There wasn't a whole lot of follow-up messaging around that. So the big takeaway here is 9%. That is the change that they noticed in this study. They said they think it's actually higher because they're sure that people weren't reporting all the symptoms. So they are claiming that at minimum a 9% benefit from wearing masks, and it may be a lot more. Now, this is a study that's in what's called preprint. It hasn't been peer-reviewed by other guys to kind of take it apart and challenge how they did the study. But I thought it was interesting. There's so much talk about masks and how much difference do they really make. Here's a study that says in the real world, out there where people circulate, a 9% reduction in spread from masking. To me, I don't know that that's all that beneficial, but I get it. You got to do something, right? There's not much we can do to stop this virus, and anything is better than nothing. So there you go. There's your COVID update. What about another challenge to our well-being, and that is that smartphone that we're all addicted to? It is Digital Detox Day, and we're going to talk about what that means next on the Health Call Live Radio Hour here on WOWO.
Podcasts by Federated Media.